Good morning, everybody, and welcome back. Mental health, of course, is a big topic that we're all talking about these days. And here to talk specifically about mental health in the workplace and how it affects our heart, we have a couple of great guests here joining us this morning. Dr. Warren Phillips, who's the president of Transformative Workplace Solutions, also clinical psychologist, and then Wesley Franklin with American Heart Association, the Community Impact Director over there. So let's start with you, and just let's talk about kind of the state of mental health right now and what we are all talking about and how important it is that we continue these conversations.
Oh, absolutely. I mean, a couple of things I think that are important to remember and to realize is that just overall, 1 in 5 Americans experiences a mental health condition that impacts their functioning at some point in their lifetime. When you look at workplace surveys, more than 76% of employees in the workplace report experiencing some sort of instance or some sort of incident that impacts their mental health.
And can you break that down for us a little bit? Does that mean we're just not happy, we're stressed, we're actually dealing with some big part of depression or anxiety? What do you mean when you say we're impacted by a little bit of mental health?
Well, there's numerous instances that can impact our mental health. Stress is one of the big ones.
Right.
So stress, chronic stress, impacts both our medical health, our physical health, and our mental health. Stress in and of itself, for example, puts us at risk for, particularly chronic stress, puts us at risk for heart disease, puts us at risk for stroke, it puts us at risk for cancers, as well as depression, anxiety, and a host of other mental health issues.
Are we, even those numbers are staggering, are we seeing any improvement because people are actually starting to talk about it a little bit more, or is everything kind of still the same because we're not really reacting and finding solutions to this?
Well, when you look at the epidemiological studies, that 1 in 5 number stays pretty consistent.
Yeah.
However, there's kind of things going on that are both, I think, hopeful as well as concerning. Hopeful things, people are talking about it more. People are addressing it more. There's less stigma around mental health and getting assistance for mental health. On the other hand, at least a third of people who have mental health conditions never seek out help and treatment. So one of the things that's important to me is to make sure that we continue to work at decreasing the stigma and just making sure that people know there's help out there, it's available.
Absolutely, and thinking of mental health at heart, which is kind of the idea of what we're talking about today. You don't always put the correlation between the two, that if I'm dealing with some sort of mental health issue, that's going to have effects on my heart.
Absolutely.
Correct?
Absolutely. And you know, as he outlined, you know, dealing with those mental health components, it does hurt our heart a little bit to some degree, and we want to keep that conversation around. And what are some tools and resources out there that can turn some of those things around? So there's not a lot of history or research around it, but there's a slight linkage between those two, mental health and how does that affect our overall heart health. So that's what we're looking at come December 12th at Des Moines University. We'll be hosting our 2nd annual Workplace Health Symposium, looking at mental health in the workplace and if there is a linkage between the heart health components. We're really blessed and excited to have Aaron Thomas, who's the son of Ed Thomas, if you're familiar with the Ed Thomas story, from Parkersburg, Iowa. He's going to be our keynote speaker. He's going to kind of help set the tone for this event and dealing with adversity, and that's going to be his overall message to the audience in this group. And then of course we'll have Dr. Warren Phillips to kind of really tackle those components around it. So we're really looking forward to this event and really having more conversation around it, so we can take that stigma, as Dr. Phillips has mentioned.
Because there's a couple of things that we can talk about, companies and businesses and what they can be doing to help with their employees with the mental health, as well as what we can be doing as individuals, correct? So let's start like from a company and a business level. What things practices are they putting into place to kind of to help the people that work with them and for them?
I think there's a lot of organizations that are putting things in place. You know, we are seeing more and more EAP kinds of services available, where people can access help for health and for mental health kinds of issues. And there's many workplaces that just have a variety of things in place to help with stress management. For example, I've known several workplaces around exercise that do things like, like exercise. It's that word where a lot of us kind of go, oh, exercise. But it doesn't have to be a chore, right? Exercise can be fun.
Movement, we're going to move.
Right. And so, you get a lot of workplaces that, they'll do things like say, hey, let's have a walking meeting And so, you know, the focus maybe isn't on the exercise, but the exercise is happening and it's part of the workplace. Workplaces that really encourage people, and I would encourage people as well, over that lunchtime hour, take your lunchtime, take that break. If it works to take a break with a friend or with a coworker, take a break with a friend. Use it as a social activity.
Because if you're looking at mental health in terms of stress or anxiety or something like that, it's hard to find a job, even if you love your job, that doesn't have some of those aspects, whether it's a deadline or pressure you put on yourself or just whatever your job might be. You're going to have some level of stress in there. So how are we avoiding that to make sure that we're staying healthy, whether it comes to our heart, our mind, or beyond?
Well, and there's several things we can do that really help us. They're very effective, that help us to manage stress. One I mentioned is exercise already, and workplaces help with that. But also paying attention to our diet and our nutrition. We know that nutrition and diet has an impact not only on our physical and medical health, but our mental health as well, particularly with anxiety and depression. Diet has an impact on that. We know that our outlook, just how we look at stress and how we view stress, has a huge impact on how we manage stress. One of the things I always talk to folks about is that the research is pretty clear that a lot of folks that really struggle with stress tend to sort of fall prey to the 3 Ps. They'll see stress as permanent, as pervasive, and they may see themselves as being powerless, versus folks that cope well with stress, the little acronym is, they tend to use their tie. Okay, they see stress as temporary. They can see where it's isolated and that it doesn't necessarily affect their entire life, and they see the places where effort counts and where effort kind of makes an impact, and that's where they focus.
Yeah, because I think it's difficult for us to remove the stress. It's really key on just how we are able to manage it and our attitude towards it. Talk about environment in our workplaces and how that affects the mental health and the conditions that we work in.
Well, you know, one of the things I always work on when I work with organizations is workplace culture. And so having a culture, for example, where empathy is a really important part of the culture, where people are really learning and being intentional about understanding where someone's coming from, kind of putting themselves in that other person's shoes. You know, if somebody's productivity, for example, if an employee's productivity is declining, perhaps there's something going on in their life, and oftentimes there is. And a lot of times if we can approach it from that perspective and have some empathy and some curiosity and some interest and offer support, not only does it increase their productivity, but it's one of those factors that as we start doing this on a more regular basis, it improves the workplace culture overall.
Absolutely. And it's interesting when you say things like your nutrition and getting up and moving. These are some of the same phrases you're using from the American Heart Association to have heart health and just a healthier person overall. So it's interesting because you use the same verbiage to make sure that we are staying healthy, whether it's your mind or it is your heart. But we're going to dig deeper into these topics with this symposium. So again, remind us, if we want to get tickets, if we want to be a part of it, how can we do so?
So the event is at Des Moines University on December 12th at the Olson Center. And for people who want to register, it is a free event. They can go to www.heart.org/Iowa Workplace Health. That's where they can go and register for the event, and of course look at information about the speakers and what the whole event entails. So it should be a very fun event, and this is something very new for the American Heart, bringing this linkage together as far as mental health and how does that impact our overall heart health. So we're really excited for it, and we want people to come out and enjoy this free event.
Yeah, and it's a great event for both for employees as well as business owners, and on that both levels, correct?
Absolutely.
Love it. Doctor, what would be your big takeaway this morning for us to learn when it comes to our mental health in the workplace and also for our heart this morning?
I would say the big takeaway is to recognize that there's help available, and that when we reach out and we support each other, it makes a huge positive difference.
Sounds like we just all need to be good to each other. That's a good place to start in the workplace.
Wonderful. Thank you both for joining us today. Of course, you can always find out what the American Heart Association is doing, because they're doing a lot of great work out there, by visiting their website. Heart.org is going to get you started. You're watching